diet, about their physical activity, about the way that they live their lives. We think that wearables are a key to the MAHA agenda, making America healthy again, and we are going to, my vision is that every American is wearing a wearable within 4 years.
Thank you, Mr. Secretary. Following up.
Politicized science and added bureaucratic red tape. While some work has been reinstated, in large part due to court orders, every member in this room, on both sides of the aisle, has heard from public health organizations and research universities in their districts about the abrupt halting of funding. I don't have time to go over all the important funding cut just at the University of Colorado, but it includes a researcher studying whether and how airborne contaminants, including glyphosate, impact chronic kidney disease, and another looking into whether viral infection accelerates Alzheimer's disease. Research labs are closing. Americans are dying waiting for care. Promising clinical trials are being delayed. And scientific research, which is the lifeblood of our communities, is stopping. I think we all read the article in the Washington Post last week about the Georgia man with metastatic cancer whose treatment in a clinical trial has been delayed because of a lack of essential lab personnel. Thanks to the chaos this administration has caused, his life is on the line. Why make these cuts? It's inexplicable. Many research cancellations appear not to be driven by concerns rooted in science, but in biases completely unrooted in evidence, such as the Secretary's animus towards mRNA technology. He ignores that COVID-19 vaccination prevented 3.2 million deaths in the U.S. between December 2020 and November 2022. Under the Secretary's leadership, the MAHA Commission, which met once behind closed doors and conducted an opaque process without public input, released an error-ridden report that misrepresented researchers' work, made up sources, and included AI hallucinated information. In looking at chronic disease and how environmental factors influence it, the Secretary has identified some real problems. Those problems demand rigorous study, and I know I and all my colleagues stand ready to work collectively to address them. But the federal workers who were unceremoniously fired could likely have helped develop a useful and informative report. The Secretary is here today to defend his fiscal year 2026 budget. This budget is a roadmap to continue the chaos of the past several months and a blueprint for a sicker and poorer America. This budget seeks to cut the NIH by 40%. What that means is less NIH-funded research, fewer high-quality studies, and a shrinking base of scientific talent in the United States. NIH-funded research underpinned nearly every single drug approval in the U.S. from 2010 to 2019. In this budget, the Secretary calls for eliminating programs to prevent death and disease, such as the National Diabetes Prevention Program, the Tobacco Prevention Control Program, and, with what you said, Mr. Chairman, the Safe Motherhood and Infant Health Program. This budget would also train fewer healthcare providers even as our population ages. It deeply cuts workforce development programs, including those that place doctors in underserved areas. We need more doctors, not less. I started by talking about our successes. These victories were driven by the very programmers, researchers, and public health professionals this budget seeks to cut. As a result, I fear the U.S. is quickly losing its international position as the leader in public health and biomedical innovation. The decline this budget fuels will cost American jobs, and it will cost American lives. I call on my colleagues on both sides of the aisle and both sides of the Capitol to reject this budget and work together to promote the health and build on our greatest success stories. I yield back.
The gentlelady yields. The chair now recognizes the chairman of the full committee, Chairman Guthrie, for 5 minutes for an opening statement.
Thank you. Thank you, Mr. Secretary, for being here today. Thank you, Chairman Carter, for the time. And I'd like to welcome you to the Energy and Commerce Committee, and it's good to have you with us today. HHS has become the largest spender of our federal departments, and whether at the pharmacy counter, doctor's office, or dinner table, HHS work impacts Americans every single day. The core mission of HHS is to enhance the health and well-being of all Americans, but Americans are
3rd, April 9th, April 10th, April 11th, April 28th, April 29th, May 28th, June 10th, June 11th, June 17th, June 22nd, and June 23rd, to which we have received no response from your agency whatsoever. Mr. Chairman, I'd like to enter these into the record, please.
Without objection?
Thank you. On June 16th, a federal judge ruled a large swath of NIH grant terminations illegal and void and vacated them, requiring that the grants resume. These grants deal with science that is disfavored by this administration, as we just heard from the witness. Judge William Young, a Reagan appointee, said that the administration's explanations for terminating the grants were, quote, bereft of reasoning virtually in their entirety, end quote. He added, quote, I've sat on this bench now for 40 years, and I've never seen government racial discrimination like this, end quote. Mr. Secretary, I have a yes or no question. Does the department intend to comply with Judge Young's ruling? Yes or no?
I will comply with
Yes
the
or no,
law.
sir?
I'll comply with the law.
Thank you. As reported, in your opening statement, Mr. Secretary, you said that you're committed to reducing bureaucracy. But as reported in the Washington Post on April 17, 2025, HHS imposed a new layer of bureaucratic review by which every disbursement has to go through political appointments at HHS. Hospitals, universities, and community health organizations have told me and the other members lately that funds are stuck at HHS due to this so-called Defend the Spend initiative. I asked you about this in the April 23rd letter over 2 months ago, to which you have not responded, and I'd like some answers. Yes or no? Did HHS conduct a cost-benefit analysis on the Defend the Spend procedures?
I don't know anything about
You don't know,
that Washington
okay.
Post article.
In letters, you don't know whether you did a cost-benefit analysis, right?
I don't know. I know that. I don't
Okay.
know anything about that Washington Post article. I
No,
don't
do you
believe
know
it's
anything about the Defend the Spend initiative?
About what?
The Defend the Spend initiative
No.
that your agency has? You don't know about it. Mr. Chairman, I have an article here dated April 17, 2025, about the Defend the Spend initiative. I'd like unanimous consent to enter it into the
Without objection?
Now, in Mr. Secretary, on June 9th, hundreds of NIH scientists sounded the alarm on how this administration has wasted millions of research dollars, injected politics into science, and damaged the public trust. 68 Nobel laureates signed this letter. On June 10th, we sent you a letter. Of course, we haven't gotten a response with our concerns that you or your staff might retaliate against them for telling the truth. So here's my question. Will you commit today that neither you or anyone else at HHS will take any retaliatory action against the brave scientists that work at NIH? This should be
I
an
can
easy
commit
answer because
this.
it's illegal.
I can commit that we are absolutely depoliticizing science at
Will
NIH
you
for the
commit
first
that
time.
you will not take any
Biden
retaliation?
administration,
Excuse me.
Ms. Chairwoman, the Biden administration politicizes science, and I just
Okay,
gave you,
excuse me,
I just
sir.
gave you 3 of
Excuse
thousands
me,
of
sir.
examples of
Excuse
how
me,
they
sir.
did that.
Excuse me, sir. I asked you a simple question. Will you commit to not taking retaliatory action against the NIH scientists that signed the letter about the research dollars? Yes
I
or
don't
no?
know anything about that letter.
You don't know about the letter?
No, I
Okay.
don't know anything about that letter. This is
Okay,
the
well,
first
we'll
I've
put
heard
that,
of it.
we already put that, our question in the record. I'd like a response. Now, in my last few minutes, in our letters dated February 28th, April 1st, and May 28th, to which you did not respond, we have some questions about reductions in force. How many HHS employees received RIF notices since you were sworn in?
I think around 10,000.
10,000. Did you personally approve those layoff decisions?
Of each one, I approved of the policy.
Thank you. You approved the policy. Your NIH director, Jay Bhattacharya, told employees, quote, I actually don't have any transparency into how those decisions were made, and I was quite upset about that. It would have been nice to have some say. I guess I'll follow up with more written questions, Mr. Chairman.
Thank you. The gentlelady yields. The chair now recognizes the chairman of the full committee, Chairman Guthrie for 5 minutes of questioning.
Thank you, Mr. Secretary. Over here on this end. So we talked about the reduction in force. So I'm going to ask you, I'll do 3 questions right quick.